In this video presented by Overpsyched, we are going to review dependent personality disorder. I'm Dr. Gerald Richardson, and let's begin with the objectives. We will first cover the diagnostic criteria. Then we will discuss some of the common features, followed by the prevalence, development, and course, and conclude with our current understanding regarding the treatment. So the DSM, or Diagnostic and Statistical Manual of Mental Disorders, has the following diagnostic criteria for dependent personality disorder. A pervasive and excessive need to be taken care of that leads to submissive and clinging behavior and fears of separation, beginning by early adulthood and present in a variety of contexts, as indicated by 5 or more of the following. 1. Has difficulty making everyday decisions without an excessive amount of advice and reassurance from others. 2. Needs others to assume responsibility for most major areas of his or her life. 3. Has difficulty expressing disagreement with others because of fear of loss of support or approval. 4. Has difficulty initiating projects or doing things on his or her own because of a lack of self-confidence and judgment or abilities rather than a lack of motivation or energy. 5. Goes to excessive lengths to obtain nurturance and support from others to the point of volunteering to do things that are unpleasant. 6. Feels uncomfortable or helpless when alone because of exaggerated fears of being unable to care for himself or herself. 7. Urgently seeks another relationship as a source of care and support when a close relationship ends. 8. Is unrealistically preoccupied with fears of being left to take care of himself or herself. So now that we have the diagnostic criteria, let's now cover some of the common features of dependent personality disorder. The core characteristic is a submissive, passive, or clinging behaviors due to a fear of separation and excessive need to be taken care of. Individuals may be pessimistic, assuming the worst outcome will happen. They may also embody a self-perception of not being able to function adequately without others, and they have difficulty with everyday decisions, such as what to wear. Individuals with dependent personality disorder frequently want or allow others, sometimes a single person, to take full responsibility for most things in their life. And this does not align with situation or age-appropriate requests. For example, a child or the elderly may normally require some assistance. Now, for adolescents who have dependent personality disorder, they may request assistance from parents for how they should spend their free time, what they should do on the weekend, who their friends should be, or what they should wear. These behaviors would not be considered age-appropriate. And in adults, they often depend on their parents beyond what is age-appropriate and may allow parents to decide what job they should have, who their partner should be, where they should live, etc. Now, as a side note, an individual with a medical condition or disability may still have dependent personality disorder, but only if the dependency that they need exceeds what is required for the medical condition or disability that they have. Individuals with dependent personality disorder may also fear losing approval. As a result, they may keep differing opinions to themselves, and they may do things that they disagree with in order to prevent losing others. Another common feature is a lack of independence for projects or work assignments, and these individuals may require constant assistance. But they may still perform well if given frequent reassurance from their supervisors. In addition to this lack of independence, there is also frequently seen a lack of self-confidence, frequent self-doubt, and they may consider criticism as proof of their inadequacy. They may also submit to others even if there are extreme demands, They may seek overprotection and dominance from others. And as a result, they may unfortunately have a high tolerance for abuse. And because of this submission to others, individuals with dependent personality disorder may be at risk of being abused or manipulated by individuals with cluster B personality traits. For example, an individual with dependent personality disorder may be at risk if they are in a relationship with someone with antisocial personality disorder or narcissistic personality disorder. And speaking of relationships, individuals with dependent personality disorder may quickly initiate a new romantic relationship when one ends. Now let's discuss the prevalence, development, and course. As is with most personality disorders, the exact cause of dependent personality disorder is unknown. However, genetics and environment likely play a large role. Chronic physical illness or separation anxiety disorder in childhood or adolescence are associated with increased risks for development of dependent personality disorder. Also, having overprotective or authoritarian parents may also place an individual at risk for dependent personality disorder. These parenting traits hinder an individual from developing autonomy. The prevalence of dependent personality disorder is estimated to be below 1%. And some studies suggest that there is a female predominance. However, others suggest the prevalence is more or less equal between males and females. In general, dependent personality disorder is a long-term condition with only a minority achieving normal independence. Some of the comorbidities include depressive disorders, anxiety disorders, adjustment disorders, other personality disorders such as borderline, avoidant, and histrionic. Now, this is not described in the DSM, but Theodore Millen described a few subtypes that you may encounter. First is disquieted dependent. This includes avoidant features. These individuals are disconcerted, feels dread, apprehensive, and vulnerable or lonely. Next is selfless dependent, which includes masochistic features. These individuals are immersed into another individual and willingly gives up their own identity. Then there is immature dependent, which is characterized by an unsophisticated or childlike, and they're incapable of adult responsibilities. Then there is accommodating dependent, which includes histrionic features. These individuals are gracious, eager, compliant, agreeable, submissive. And finally, there is ineffectual dependent, which includes schizoid features. And these individuals are incompetent, they seek untroubled life, and refuse to deal with difficulties. So our final point will be treating dependent personality disorder. Like all other personality disorders, psychotherapy is the mainstay of treatment. The goal of psychotherapy is to develop greater independence and facilitate more healthier relationships with others in their lives. The focus is on developing greater self-esteem and confidence. There are no first-line medications for dependent personality disorder, but if there is co-occurring depression, anxiety, etc., medications then may have some benefit. This concludes our discussion on dependent personality disorder. Thank you for watching, and be sure to head over to overpsyched.com for more resources.